What if the problem is not just low testosterone, but that your body may be struggling to breathe properly while you sleep? A lot of men over 40 never seriously consider that possibility. They feel tired, foggy, less driven, more irritable. Their workouts feel weaker, their sex drive slips, and the mind grabs the most familiar explanation. It must be testosterone. But that is exactly where a lot of men get stuck, because in some cases, what looks like a testosterone problem may actually be a sleep-breathing problem, or a mix of both. And if that connection gets missed, the real issue can keep draining your energy, your mood, your motivation, and your quality of life night after night. So before you assume this is just aging or just hormones, take a closer look at what may be happening to your body all night long. Now, to be clear, this video is for education, not medical advice. Low testosterone can matter. Aging can matter. Stress can matter. Weight changes can matter. Alcohol can matter. Medication side effects can matter. Poor sleep can matter. Mood can matter. That is the entire point. A lot of men try to explain a whole body change with one word: testosterone. And sometimes that word is part of the story, but sometimes it is not the center of the story at all. Sometimes the thing quietly wearing a man down is happening in the dark while he thinks he is resting. That's why this conversation matters, because what happens at night often shows up during the day in ways that are easy to mislabel. A man does not wake up and say, "My breathing may have been disrupted over and over last night." He wakes up and thinks, "Why am I still exhausted? Why do I feel mentally dull? Why is my patience shorter? Why am I feeling less interested in sex? Why am I feeling weaker in the gym? Why am I feeling like I'm moving through the day with the parking brake half on?" And because our culture gives men a ready-made explanation for that feeling, many of them settle on the label before they ever understand the pattern. That's the part I want to challenge. Because one of the most damaging things a man can do here is grab the most emotionally satisfying explanation too early. Low testosterone sounds familiar. It sounds clean. It sounds like the answer that ties everything together. But a familiar explanation is not the same thing as the right explanation. And in a moment, I want to show you the exact kind of symptom pattern that many men overlook for far too long. First, let's talk about why this gets so confusing. When most men think about sleep apnea, they picture loud snoring. When most men think about low testosterone, they picture low energy, lower libido, reduced motivation, maybe changes in strength, maybe changes in body composition, maybe the feeling that they have lost their edge. But real life does not divide itself into neat categories. Poor sleep quality can spill into mood, concentration, recovery, motivation, blood pressure, metabolism, and sexual health. Hormone-related issues can affect some of those same areas too. So the overlap is real. And when overlap is real, lazy conclusions become dangerous. That does not mean every tired man has sleep apnea. It does not mean every libido change points to hormones. And it definitely does not mean one symptom leads neatly to one diagnosis. It means a lot of men are telling themselves the wrong story because the symptoms live in the same neighborhood. They say, "Of course I'm exhausted. I'm getting older. Of course I'm less interested in sex. My testosterone must be dropping. Of course I'm more irritable. I'm under stress. Sure, I snore. A lot of guys snore." And maybe some of that is true. But what if the snoring is not just background noise? What if waking up tired is not just age? What if the sense that something is off is not 4 separate annoyances, but one pattern that has never been looked at properly? That possibility matters, because the real danger here is not just misinformation, it's fragmentation, treating fatigue as one issue, poor sleep as another, mood changes as another, lower libido as another, reduced exercise performance as another, and never asking whether those pieces belong to the same puzzle. That's especially common in men who are still functioning well enough to push through. They go to work, they show up for family, they keep paying the bills, they keep handling responsibilities. From the outside, they still look operational. But underneath all of that, they feel duller, heavier, less resilient than they used to. Not dramatically broken, just not right. And that can be one of the hardest states to recognize. Because when symptoms build slowly, they start to feel normal. You forget what rested used to feel like. You forget what mental clarity used to feel like. You forget what stable motivation used to feel like. You forget what it felt like to move through a day without dragging part of yourself behind you. That quiet erosion is one reason this topic lands so hard for so many men. Because this is not just about being sleepy. It is about feeling subtly disconnected from your old baseline. Like your body is present, but not fully cooperating. Like your mind is working, but not cleanly. Like your energy exists, but you cannot reliably access it. And that kind of decline is hard to explain to other people. Sometimes it is even harder to admit to yourself. Here's the mini story a lot of men will recognize. Picture a man in his late 40s. He still works, still shows up, still gets things done. But in private, he knows something has changed. He falls asleep on the couch more often. He wakes up tired even after what should have been enough sleep. He feels flatter with his wife. His workouts feel weaker. His fuse is shorter. His focus slips in the afternoon. He tells himself he just needs to be more disciplined. Then he hears other men talking about testosterone, and suddenly he has a theory that feels emotionally satisfying. That must be it. It explains the fatigue. It explains the lower drive. It explains the weaker workouts. It explains the sense that he has become a lesser version of himself. But what he may not be asking is whether he is actually recovering at night, whether he is sleeping or just lying unconscious while his body struggles through repeated interruptions. That's the question many men miss. And if they miss it, they can spend a long time trying to explain the daytime damage without ever seriously examining the nighttime pattern. Reflective question number 1. Have you been treating fatigue, poor sleep, lower motivation, and sexual changes like separate annoyances without asking whether they might actually be connected? Here's the part many men never hear clearly enough. You can feel like your body is losing power when what is really happening is that your sleep is losing quality, and those are not the same thing. When sleep is repeatedly disrupted by breathing problems, the effect is not always dramatic. It's often subtle, cumulative, easy to misread. A man may not describe it as a sleep problem at all. He may just say he feels heavy, foggy, undercharged, short-tempered, less alive in his own body. That's why this conversation matters so much in midlife, because the exact areas men worry about most, energy, motivation, mental sharpness, exercise recovery, and sexual health, are also areas that poor sleep quality can quietly erode. That doesn't prove sleep apnea is the answer. It doesn't prove testosterone is irrelevant. It means the symptoms can point in more than one direction, and that's where mature judgment matters. Now, let's correct a myth that causes a lot of confusion. Myth: if a man feels exhausted, less interested in sex, mentally off, and unlike himself, testosterone is automatically the main explanation. That's too simplistic. Energy, libido, mood, performance, and motivation don't belong to one system alone. They're shaped by sleep quality, stress, body composition, alcohol use, medications, mental health, cardiovascular strain, relationship context, and yes, sometimes hormones too.
So when a man jumps too fast to one explanation, he may ignore a broader pattern that deserves attention. The same thing happens with snoring. Snoring alone is not a diagnosis. That matters because men tend to make one of two mistakes with snoring. They either panic over it or they dismiss it completely. One man hears he snores and assumes something must be seriously wrong. Another hears he snores and shrugs because his father snored, his uncle snored, and half the men he knows snore. But snoring is better understood as a clue, not a conclusion, and that distinction is everything. If snoring shows up alongside waking unrefreshed, dry mouth, morning headaches, daytime fatigue, gasping, witnessed pauses in breathing, or excessive sleepiness, the pattern becomes more important. Not because that confirms a diagnosis by itself.
Because it makes proper evaluation more worth having. That is how adults should think about this. Not in shortcuts, not in internet certainty, not in one symptom thinking, in patterns. And emotionally, this matters more than many men admit. Because a lot of men are not just tired, they are confused by who they have become. They remember feeling sharper, more decisive, more physically capable, more interested, more emotionally steady. Now they feel like they are dragging themselves through the day. And they want one explanation that makes the whole thing make sense. That is human. But a satisfying explanation is not always an accurate one. Sometimes what feels like decline is partly non-restorative sleep. Sometimes what feels like a hormone story is really a broader sleep and health story. Sometimes both conversations matter. That middle ground is where good medicine usually lives. Not in certainty, not in self-diagnosis, not in the assumption that one label explains everything. In the fuller picture. Reflective question number 2. When you think about how you have been feeling lately, are you focusing on the label that feels most familiar or the pattern that best fits what is actually happening? This is where the conversation gets more honest. Because men over 40 are rarely dealing with one clean variable. They are dealing with layers. Maybe weight has changed. Maybe stress is higher. Maybe sleep hours are shorter. Maybe alcohol has become a regular evening habit. Maybe exercise is less consistent. Maybe mood is lower. Maybe blood pressure is creeping up. Maybe metabolic health is shifting. Maybe hormone changes are part of the picture too. That is why symptom overlap becomes so easy to misread. A man wants one answer, but the body often gives him a network. And that network matters because sleep apnea does not exist in isolation. Neither do testosterone-related concerns. Both can sit inside the same broader context of aging, body composition, recovery, cardiovascular strain, insulin resistance, stress, alcohol, and declining sleep quality. That does not make them interchangeable. It means they can shape the same lived experience from different angles. So, if a man says, "I feel exhausted, foggy, less interested in sex, and not like myself," the smartest response is not, "It must be this one thing." The smartest response is, "Let's respect how many systems can shape that feeling." That may sound less exciting, but it's far more useful. Because the oversimplified version usually goes like this: I feel off. Men my age talk about low testosterone, so low testosterone must be the answer. But there's a second oversimplified version that can mislead people too. I snore, I'm tired, so sleep apnea must explain everything. That's not the goal either. A better way to think about it is this. When several symptoms cluster together, especially fatigue, non-restorative sleep, brain fog, mood changes, lower motivation, and sexual health concerns,
it may be worth asking whether sleep quality and nighttime breathing belong in the conversation alongside other possible factors. That's a much smarter question than trying to crown one explanation too early. And this is the exact point where many men finally realize they've been observing symptoms but not really observing the pattern. Because symptoms are individual, patterns are relational. A symptom is, I'm tired. A pattern is, I'm tired, I snore heavily, I wake up dry-mouthed, I'm foggy by noon, and my partner says I sometimes stop breathing. A symptom is, my libido is lower. A pattern is, my libido is lower, I feel unrested, I've gained weight, my mood is flatter, and I haven't felt mentally clear in months. That's a very different level of awareness, and it's often the difference between vague concern and a genuinely useful medical conversation. And before we get to the practical next step, there's one more reason men stay stuck for so long. They're waiting for a dramatic event, a collapse, a crisis, a moment when the problem becomes undeniable. But many health problems do not announce themselves that way. Sometimes they arrive gradually, quietly, and persuasively. They convince you that what is changing is just life, just age, just stress, just a busy season, just another part of getting older. And because that explanation sounds reasonable, it can delay the moment when you finally step back and ask a better question.
Not what label sounds familiar, but what pattern has been repeating long enough that I should stop brushing it off? That is often where clarity begins. Some men snore loudly and do not have obstructive sleep apnea. Some men do have clinically meaningful hormone issues. Some men have both sleep-related and hormone-related concerns, shaping the same quality of life problems. Some men are mainly dealing with chronic stress, depression, alcohol, medication effects, excess weight, fragmented sleep from other causes, or multiple issues at once. In other words, overlap is real. Automatic conclusions are risky. That is why I think the healthier mindset here is not explanation hunting, it is pattern recognition. Explanation hunting asks, what is the one name for what I feel? Pattern recognition asks, what combination of symptoms, habits, risk factors, and changes keeps showing up together? That shift protects you from shallow conclusions. Maybe the pattern includes heavy snoring, waking unrefreshed, morning headaches, daytime sleepiness, and a partner noticing breathing pauses. Maybe it includes declining vitality, lower strength, lower libido, or changes that also deserve a hormone discussion. Maybe it includes both. The point is not to become your own doctor. The point is to become a better observer before you speak to one. And for many men, that is harder than it sounds. Not because they are careless, because they are used to enduring. They normalize fatigue. They treat poor sleep like background noise. They turn lower motivation into a character issue. They turn lower sexual interest into private embarrassment. They keep delaying the conversation because they don't want to sound dramatic. They also do something else that hurts them. They compare themselves only to the men around them, not to their own previous baseline. If other men their age seem tired, then tired feels normal. If other men joke about snoring, then snoring feels harmless. If other men talk about low testosterone, then that explanation starts to feel almost automatic. But common is not the same as unimportant. And a lot of men deal with this is not the same as this deserves no real evaluation. So the pattern develops in silence, and when they finally talk about it, they often describe months or years of feeling off without ever putting the whole picture into words. That's the real cost of oversimplifying too early. It delays a better conversation. Reflective question number 3. Are you looking for one neat answer because it feels reassuring? Or are you willing to notice the full pattern, even if the pattern is more complicated than you hoped?
Now, let's make this practical. The takeaway is not, you probably have sleep apnea. It is not, this is really low testosterone. And it's definitely not, I can figure this out from symptoms online. The grounded takeaway is this. If you're a man over 40 who feels unusually tired, unrested, mentally foggy, less motivated, or different in your sexual health, stop treating those changes like random annoyances. Start describing them as a pattern. That single shift can make the next conversation much more useful. Because mainstream medical practice doesn't diagnose obstructive sleep apnea from snoring alone, and it doesn't diagnose testosterone deficiency from symptoms alone either. Those are both important boundaries. Sleep-related breathing problems can involve repeated breathing interruptions during sleep, and common clues can include loud snoring, gasping, witnessed pauses in breathing, waking unrefreshed, dry mouth or morning headaches, and daytime fatigue or sleepiness. At the same time, testosterone concerns are not settled by a vibe, a social media post, or a symptom checklist. That conversation depends on symptoms plus appropriate clinical evaluation, including proper lab work when a clinician believes it is indicated. That distinction matters, because once you understand that overlap is real, your next move becomes clearer. Instead of asking, which one do I have? A better question is, how do I describe what has been happening clearly enough that a qualified clinician can evaluate the full picture? That changes everything. It might sound like this. I've been waking up unrefreshed even when I think I slept enough. I've been more fatigued, foggy, or less motivated than usual. My partner says I snore heavily. Someone has noticed pauses in my breathing. I may be waking with a dry mouth or morning headaches.
I've also noticed changes in libido, performance, or overall drive. I don't want to assume one cause. I want to evaluate the full pattern. That is a smart conversation. That is a responsible conversation. And that is far more useful than walking in convinced you already know the answer. Because this is where shortcuts stop helping. Snoring alone does not diagnose obstructive sleep apnea. Fatigue alone does not diagnose testosterone deficiency. Lower libido alone does not tell you which body system is driving the problem. Those symptoms can overlap across sleep disorders, stress, depression, alcohol use, medication effects, weight changes, metabolic issues, and other medical conditions. That is exactly why serious evaluation matters more than guesswork. And there is another reason this topic hits so deeply. A lot of men are not really looking for a diagnosis at first. They are looking for permission to take what they feel seriously. They know something has changed. They just don't know whether it's important enough to bring up. It is. Not because one symptom tells the whole story. Not because it automatically means something severe, but because persistent fatigue, non-restorative sleep, loud snoring concerns, breathing pauses noticed by a partner, mood changes, or sexual health changes deserve a real conversation, not just quiet self-explanations. There's also one more boundary that matters. Do not turn awareness into self-treatment. Do not assume a supplement, a hormone theory, or a sleep gadget solves the whole problem. Do not start, stop, or change medications on your own because a video sounded familiar. Do not let internet certainty replace a proper workup. The mature mindset is this: symptoms can overlap, causes can overlap. Good evaluation helps sort them out. That is the real takeaway. Not fear, not hype, not "I finally found the one hidden cause." Just a better lens. A lens that says, maybe this is not about blaming everything on age. Maybe this is not about blaming everything on testosterone either. Maybe the better move is to bring sleep, breathing, energy, mood, and sexual health concerns into the same conversation and let the full pattern be assessed. And maybe that's the real shift. Not becoming obsessed with diagnosis, not becoming anxious over every symptom, but becoming honest enough to stop living in fragments. Because that's what many men have really been doing. They compartmentalize the tiredness, compartmentalize the irritability, weaker workouts, loss of drive, snoring, sexual changes, brain fog. And once everything is compartmentalized, nothing gets fully understood. But when the pattern is finally seen as a whole, the conversation changes. The quality of the questions changes. The quality of the evaluation can change. And that's often how confusion starts turning into clarity. Reflective question number 4. What would change if instead of trying to name the problem by yourself, you brought the full pattern into one honest conversation with a qualified clinician? That is where I want to leave you. Not with a dramatic conclusion, with a better question. If your body has been telling a story in fragments, poor sleep, low energy, brain fog, lower drive, weaker recovery, feeling unlike yourself, maybe the next step is not choosing one label too fast. Maybe it's finally looking at the full story. Maybe it's recognizing that what feels vague to you may not be vague at all once it's described clearly. Maybe the problem is not that you're failing. Maybe the problem is you've been trying to interpret a pattern with only one category. And maybe the most productive move isn't guessing harder, it's observing better, speaking more honestly, and allowing the right conversation to happen. Because sometimes the body doesn't fail all at once. Sometimes it whispers for years, and the turning point is the moment you stop explaining it away. This video is for education only and is not medical advice. It is not a diagnosis, and it is not a recommendation to start, stop, or change any treatment. If symptoms are persistent, worsening, or affecting safety, daily function, or breathing during sleep, seek professional medical evaluation promptly.